Welcome to a special CBC News Town Hall on the topic we're all thinking about, COVID-19 vaccines. Where are they? What's in them? How effective are they? And when can you get yours?
That is the big one. 1 year, if you can believe it, into the pandemic. COVID-weary Canadians are looking for a much-needed shot in the arm. So tonight, we are rolling up our sleeves to answer your questions. Think of this as a modern-day call to arms, the largest mass immunization campaign Canada has ever seen. Our chance to save lives, the shot that gives us a shot at some kind of return to normal.
For lots of people, it'll make life easier.
But this is also a race against time. New variants pose new threats, and COVID-19 infection rates are still too high. Also, doesn't March 2021 look an awful lot like March 2020? Canadians are tired of lockdowns, frustrated with isolation, and that the vaccine is so close. The anticipation can be hard to handle.
We're really fortunate, and we recognize how fortunate we are.
Let's step back, though, because there is so much hope in this moment. Science delivering the bright light at the end of a dark year. Rightly so, you want to know when your turn will come. Well, that timeline looks different depending on where you live. It's a patchwork rollout already plagued by criticism and confusion. And now it's about to ramp up.
Millions of doses are scheduled to arrive over the coming weeks, so one by one, Canadians are lining up, masks on, 6 feet apart. A moment hard to imagine. A year ago, now our reality.
1, 2, 3.
This is our shot.
And welcome everyone to the National Studio. This is where every other night we tell Canada's story, and tonight it's all about your stories, your questions on Canada's COVID-19 vaccination efforts.
Yeah, indeed. Canadians from all across the country joining us tonight. Hey, guys, could you give Canada a good wave here? Hello. There we go. Watching, they'll be interacting, of course, with us tonight through screens, as we are all so accustomed to doing these days. Also with us, helping get some answers, Dr. Madhu Jawanda, a family physician in Vancouver and member of the Surrey South Asian COVID Task Force. In Toronto, geriatrician Dr. Samir Sinha. We also have infectious diseases specialist Dr. Alison McGeer. And from Montreal, Dr. Fatima Kakar, a pediatric infectious diseases doctor. Because, Adrienne, we've got lots of questions about kids, too, a whole range.
About kids, from kids, those are always good questions.
Yeah.
All these questions have poured in through emails, through text, through video. More just keep coming. So you can send them through Facebook, Twitter, and to our email, covid@cbc.ca.
Yeah, so questions, we love to get them, and we're going to get right to them. Brenda joining us live. Brenda Marriott, hey, how are you doing?
I'm great, thank you.
Nice to see you. What is your question for our doctors?
I am wondering if the vaccination schedules set out by the provinces are likely to change with the approval of the new vaccines.
Right, because we have 4, essentially, down the pipeline, approved here in Canada. Dr. McGeer, can you take that one on? The timelines have already shifted to some extent.
Yeah, so I think we've agreed on the principles of who we're vaccinating and more or less what order we're vaccinating them in. But you're absolutely right. With so many more vaccines coming, it just leaves you options to do things more quickly and maybe make things simpler. And remember, at the same time, there's also more data and information coming in. So I think it's a safe bet that we will be changing some of the things we've decided on in the next few months, partly for speed and efficiency, and maybe because there's going to be new data coming that will help us do it better.
And even beyond that, Dr. McGeer, I'm thinking of the fact that the dosage interval, right, when we're talking about Pfizer and Moderna, we're getting more first doses into more arms at a faster pace than before. Do you see that as having a big impact on the rollout?
Yeah, that's really advantageous at the moment, and it just requires keeping a sharp eye on making sure that the first dose protection lasts long enough that we don't have to sort of crowd up and get second dose into some people a little bit earlier than the 4 months. But being able to go down to 1 dose really allows us to expand the number of people that we can get a dose into. And so far, our experience with single doses is limited to residents of long-term care facilities, but those are the people who who we expect to least well respond to the vaccine, and it's been amazing in long-term care. Disease has just vanished.
Brenda, do you already have a sense of where in the queue you are?
I think it keeps changing by the day practically. I think it's July and maybe now June. I'm not sure.
Okay, well, we're all crossing our fingers that it happens sooner rather than later. Brenda, great question. Thank you so much. Okay, let's link up now with Derek and 7-year-old Elliot. Elliot, do I have your age right? 7?
Yes.
Okay, what's your question, guys?
Dear COVID expert, I'm Elliot and I'm in grade 2. I would like to get my vaccine so I can stay safe at school. When will kids like me be able to get vaccinated, and why is it taking so long?
Oh, that is an excellent question. Dr. Kakar, why don't you take that one?
Great question, Elliot. So the most important reason, the biggest reason is that while kids can get COVID, kids actually haven't been very sick from COVID. So it's actually been pretty amazing. It's almost like a mild cold, or many kids haven't had any symptoms at all. So before we give kids a vaccine, we absolutely have to make sure it's safe. So we're doing clinical trials, and those have actually started, and we're going to look to make sure that it's very safe. But until we know that it's safe, because kids aren't being hospitalized and very sick, we're not going to give you guys the vaccines right away until we're absolutely sure they're safe for you.
Dr. Kakar, are we in a position to kind of look into crystal balls and figure out when we might realistically expect children to get the vaccine?
Yes, there's actually great news on the clinical trials front. Pfizer has finished enrolling from 12 to 15-year-olds, and they're actually starting the younger age groups, Moderna as well, and AstraZeneca. So the clinical trials are underway. I think Pfizer is probably the one that's fastest ahead, and we're hoping to actually have some results by this summer so that potentially by early fall, some kids will be getting their vaccine.
Right, and the Pfizer one is an interesting one because it is actually authorized for use in Canada for people 16 and up. Derek, so you're Elliot's dad. What would getting vaccinated mean for you and your household and making sure that everyone's safe?
Thank you. So I'm quite fortunate in that my wife and I are both healthcare workers, and we've been able to get vaccinated. But I really would like to see the broad availability of clinical trials for children and adolescents so that we can make sure, A, they are safe, and that we can hopefully get Health Canada approval broadly. My question is there a timeline for getting our youngest and potentially more vulnerable young children, including my 2-year-old? When will these be tested, and when will we know whether these are safe or not?
Yeah, Dr. Kakar, do you want to field that timeline question? I mean, as you get younger and younger down the scale.
Exactly. So we're actually working our way backwards. So the 12 to 15-year-olds will have the quickest approval. And actually, there are some emergency recommendations that if we do have very high risk, NACI has put out a statement that we could consider the vaccine for 12 to 15-year-olds, only the Pfizer shot. So the 12 to 15-year-olds will be the first group, and then the 5 to 11-year-old group, and then the youngest. So we're looking at a staggered timeline, but it's unlikely, in all likelihood, will be the older kids potentially as soon as the summer, and then the younger kids hopefully by fall. But really, all 4 of the major vaccine companies are doing their clinical trials. And while there aren't clinical trial sites in Canada yet, there are actually sites all over the world where they have much larger numbers of kids who are at risk for COVID. So these studies are underway, and there are probably going to be clinical trial sites in Canada coming up in the next few months as well.
Dr. Kakar, thank you. Derek, Elliot, thank you guys so much for the excellent questions. Now, it is absolutely worth bearing in mind that as far as these vaccination timelines go, they are decided on a provincial level. Each has announced their own plans, but those can change if necessary. So here's where they stand tonight. Across Canada, the emphasis remains on seniors, but some provinces do have tighter targets than others. Manitoba is only giving shots to those 95 and older. In BC, seniors 90 and over can start booking vaccination appointments. New Brunswick is already giving shots to seniors 85 and up. Same goes for Quebec, vaccinating seniors 85 and up. In Ontario, the plan is to start vaccinating those 80 and up in mid-March, and Alberta is throwing the door open even wider, offering vaccines to those 75 and older, while Yukon, Northwest Territories, and Nunavut are giving shots to everyone 18 and up.
And speaking of Yukon, you know, this is a live shot from Yukon right now. That's a vaccination clinic. Interesting place because, you know, Whitehorse is the first capital city in Canada to start to give the shot to people over the age of 18. Already nearly 21% of all people in Yukon have been vaccinated. It is an extraordinary thing. So this is not just theoretical. This is happening as we speak. We're hoping to be able to hear from some of the people who are there in Whitehorse tonight. But before we do that, let's go to a question from Catherine Binks.
My name is Catherine Binks, and I live in Scarborough. I'm 84 years old, and my husband is 94. We're still living in our own home with the support of our son and his wife in their 60s who live with us. When we receive the COVID vaccine, will they also be able to receive it at the same time?
Okay, that is an excellent question. And Dr. Sinha, that is one for you. And I have to tell you, about half of the questions we receive from seniors are on this subject. You know, people who are in a household with different ages and what they do. What would you say to her?
Yeah, so, you know, Catherine asked a great question because many people are living at home in intergenerational situations, or they're receiving help from loved ones, and they're wondering, well, what about my caregiver? What about those other family members? So right now, Ontario has started in the Toronto region and throughout other regions, vaccinating people 80 and older. What we do know right now is that the plan for the rollout is that starting in April or just thereabouts, they're going to start inviting people who are actual caregivers for example, people like Catherine and her partner, so that they would be able to be vaccinated as well. But otherwise, we're going in an age-based format. We're going from oldest to youngest, and then we'll be starting to concentrate on people who might also have chronic conditions. So the key advice I give to everybody is we're not necessarily vaccinating an entire household at the moment. We're vaccinating the people with the highest risk first, but certainly it's always good to keep up to date on the public health unit's guidance, just to see whether you qualify based on age or comorbidities. If you have an illness or condition, that might qualify you sooner.
I'm curious, Dr. Sinha, how alive that conversation is about the households, because I think about the stress level of trying to book one person for a shot, trying to book 2 or 3 or 4 and getting them there and standing in line and coming back and doing it again. That takes an enormous toll on people. So I'm wondering how much of an incentive that is to have that conversation about vaccinating households.
Well, it's an interesting proposition. I have couples, one who's in their 90s and one who's in their 80s, and they're saying, wait a minute, they can get vaccinated, but I can't. And wouldn't it be more efficient if we all just went down together? And heck, my caregiver brought me here. Why can't they get the shot now? Because I want to protect them. I had my 98-year-old who tried to negotiate with me yesterday from the vaccine center saying, could you talk to them here and tell them to vaccinate my 60-year-old caregiver? So, I mean, people are asking really good questions, but the key is right now, we don't have enough vaccine for everybody. And our goals right now are to save as many lives as possible and protect as many people from ending up ill and in hospital and potentially dying. That's why, again, right now, we're trying to vaccinate by people based on risk. But soon enough, we're hoping that Catherine and her entire family in Ontario should hopefully be vaccinated before the end of the spring.
All right, Dr. Sinha, thank you. I totally get the impulse to try to negotiate. I mean, when you're anxious, you do whatever you can.
And yet at the same time, I mean, we've been waiting for how long now,
right
for a vaccine? Only a little while longer, as I think, what the prevailing wisdom is these days. Hey, let's go back to our live virtual audience. Jean-Marc, you've been standing by, one of the many people, I'm sure, with your brain full of questions. We've got time for one. What have you got?
Well, yeah, my name is Jean-Marc. I'm from Aurora, Ontario. My main question is, does the vaccine prevent or limit the shedding or spreading of the virus?
That's so excellent question. Dr. McGeer, why don't you take that one?
Yeah, you're right. Another really good question, and one that we still don't have absolute numbers on. So when the original studies were done, they were just done about how well this vaccine prevented disease. Because it's much more complicated and difficult to do trials that ask whether it prevents transmission. So now we're waiting to see for what people call real-world data. We're observing what happens, and we're asking whether there's evidence that people are less likely to transmit when they get sick. And that evidence is coming in, and it's telling us what we expected, which is that, yes, when you've been vaccinated, the risk that you will transmit to other people is reduced. We just don't have a solid number on it yet. And so that's why you're still hearing public health officials being reluctant to say it's okay if you're vaccinated to take your mask off. It's okay to have contact with other people, because we still don't know how well the vaccine prevents transmission. So for people who are lucky enough to be vaccinated, you need to take pleasure in the fact that you've been able to get the vaccine, but still be really conscious of the need for you to protect others by maintaining social distancing and wearing your mask. And hopefully by the time we get to lots more people being vaccinated in the next few months, we'll know that you can't transmit disease when you've been vaccinated, and we can get rid of the public health restrictions more quickly.
But Dr. McGeer, I guess, if you look down south, I mean, clearly there's enough evidence for the Americans to feel comfortable in saying, hey, it's okay if you have two vaccinated people, for example, getting together. Would you expect that to kind of light a fire under the Canadian government to make a similar sort of declaration?
I don't, I'm not sure we should be looking to the Americans for how to manage COVID, okay? I'm sympathetic to if you have had vaccine, and you'll notice that they're still pretty restricted. It's okay, if there's two of you and you've both been vaccinated, you can touch each other briefly, okay? So it's not a whole opening up of society, and I do think, in the same way that I know it's taking the patience of Job for everybody to wait their turn for a vaccine. I think we also just need to wait a little longer until we're sure. The last thing we want to do is, set off another fire and overcrowd our intensive care units in our hospitals again when we're so close to getting the vaccine out.
Fair enough. Jean-Marc, great question.
Indeed. So let's go to a question that has come into us online. It's from Gay Coburn. Let's have a little look at this. To speed up the vaccination process, is there a plan to open clinics on a 24-hour basis? I get that question. Dr. Chawanda, what would you say to that?
I think that's a great question. And right now, there are no plans due to the vaccine supply. However, moving forward, BC is prepared to go to 15 hours. I know there's talk in Ontario of 24 hours, but again, vaccine supply. Once we have that vaccine supply, I think all public health officials and government officials would be totally on board to vaccinate as many people as quickly as possible, and also to accommodate people who aren't working the traditional hours that vaccine clinics are currently open. So I think it's a great idea moving forward, and again, depending on vaccine supply.
So Dr. Chawanda, you're a family doctor. Are these the sorts of calls that you're getting at your practice for people saying, I will be there at 3 a.m.?
Oh, absolutely. Lots of calls about the vaccine and various questions. And I think it's important as healthcare workers for us to answer those questions to help reduce vaccine hesitancy and get as many injections as we can into all Canadians.
Okay, so just a totally unscientific survey here, Andrew, for our Zoom audience. Hands up, if I may, if you would be willing to get up in the middle of the night to go somewhere to get a vaccine.
Well, there you go.
Yeah, well, basically they're all up. Mine is up too.
Right. Yeah, okay, so lots more to come after the break.
That's right. So a lot of the ground has been covered. We're going to try to do a lot more. The frustration of people who are trying and failing to get the shot is something that we are hearing a lot, but there's also joy in this, right? So the joy of knowing you're going to get it, the joy of actually getting it. So let's have a look at that, a look at what this is all about. We'll be back in 2 minutes.
I got my COVID-19 vaccine. It was a wonderful experience. I was looking forward to it. So afterwards, I decided to go on a frozen lake to do Bhangra dancing. I wanted to celebrate that hope. Getting the vaccine, I was feeling that it is not for me, it is for everyone. Like it is creating hope for the whole humanity.
Well, welcome back to our special town hall on COVID vaccines. Let's go to Whitehorse. Whitehorse is, of course, where people are being vaccinated right now. It's the first capital city in Canada to offer those vaccinations to people over 18. Paul is standing there. So, Paul, nice to see you. I know you have a question for our doctors. What's on your mind?
Hi, my name is Paul Jacobs, and I was just kind of curious why we're getting the vaccine and the travel restrictions and restrictions into visiting friends in the home isn't being lifted, and it doesn't look like there's anything in the near future for it. Just kind of curious about that.
Okay, Paul, thank you. Before I put your question to Dr. Juanda, it seems that it's -5 where you are and you're in short sleeve shirts. You okay there?
Oh yeah, it's nice out. It's from where we come from. It's we come from colder weather, so this is nice right now.
And have you had your shot, Paul?
Yes, I just currently had my first shot.
Ah, congratulations. Well done. Okay, to your question, Dr. Juanda.
Well, I think all of us would love to travel, but we can't travel. It goes against our public health guidelines. And the reason is we don't have enough Canadians vaccinated. So the risk of transmission is really, really high. We don't want to spread the disease. We want to keep it within our own space. We don't want to take it to other provinces, to other people's homes. My parents live in Edmonton. I haven't seen them for over a year. I am fully vaccinated now, but I would never, ever leave my city to go and potentially take an illness to another province or to elderly parents. So to keep all Canadians safe until we hit herd immunity, which is a number that we like to say 70 to 75%, we really can't talk about lifting travel restrictions. And really it's about keeping all of us safe. So I like to see it as no one is safe until we're all safe. And we do need that community immunity to open up borders and open up travel restrictions even within our own country.
Okay, thank you. That's hard to hear, eh, Paul?
Yes, it's very hard to hear, yeah.
Okay, but you've got your shot. You're well on your way.
All right.
All right, thank you, Paul.
I can hear, so.
Okay, let's take a quick look at the state of the vaccination campaign across the country, the overall situation here. After a slow start, things are speeding up, but lots of folks will still tell you not fast enough. Just over 2.5 million doses have been administered. Only about a third of those people are fully vaccinated, receiving both doses. That's 1.5% of the population, mostly seniors. And it's a pace that mostly holds true no matter where in Canada you go. We don't have all the data from Quebec, but Ontario is roughly 1.9%. Alberta, a hair over 2%. BC, around 1.7%. Now, some of the provinces with fewer people are doing a little better. Manitoba and Saskatchewan, both over 2%. PEI, over 3%. But the rest of Atlantic Canada, under 2%. The North is the outlier. Still, with the worst of the supply issue perhaps behind us, the government says more than 14 million Canadians should be able to get the shot by July, and everybody else who's eligible by September. That date, that month, can't come soon enough. More questions coming in strong here. We've got Mike Sullivan. Hi, Mike.
Hi, Andrew.
Hey, what's your question?
So I'm a senior. I'm 68. I live in Stratford, Ontario. And we've been told that it'll probably be June, maybe the end of May, beginning of June, before people over 65 in Ontario are vaccinated. But if I lived in Alberta, I'd be getting vaccinated next week. Why the vast difference? Is there more vaccines arriving in Alberta? Is Ontario turning some back? What's going on?
Right. Dr. McGeer, do you want to field that one?
So yeah, this is one of the hardest things about being part of a federation, right? We don't have one health system. We don't have one set of rules about how we're distributing vaccines. And of course, we also don't have population ages distributed in the same way, so that there are some provinces like Ontario and British Columbia that have older populations than other provinces like Alberta. So proportionally, there's just more of us old folk in Ontario, and that slows things down a bit. I do think one of the things that I think the vaccine task force in Ontario is trying to do is to underpromise so they can overdeliver. So I'm hoping that at 68, you're not going to have to wait until June. It'll be a month or maybe 6 weeks, and I totally get the fact that that feels like forever. But it will be gone. It will be over, and we can't make the vaccine distribution identical everywhere across the country. So we're going to have to live with, I think, non-trivial variation from place to place about exactly what order people will get done in, and the best you can say is, at least it's all coming. Every time I get frustrated with the process, I think to myself, in November, you thought we weren't going to be vaccinating anybody until May, okay? So there's good reason to hold on to the fact that this is a miracle, even if it's a much slower miracle than all of us would like.
Hey, Mike, I hope you can grab onto a little thread of that optimism there.
Well, we hope so, yes.
All right,
Thank you.
Mike, thank you so much for your question. But boy, I mean, it just goes to show you, right? One of the most pressing questions that we continue to get is, when can I get my vaccine, and who can get it, why at different times than other people? That's not even just a regional issue, right? People in different workplaces, different environments.
Households.
Yeah, exactly. They all have the same question.
And I think we all get it. The novelty of this thing wore off on day 2, and this is like the last bit of a race. Those kilometers are sometimes the hardest because you can see that finish line, but you're just not there. Let's go to a teacher. Stuart Cohen has a very good question. Stuart?
Thank you, Adrienne, Andrew. I appreciate the opportunity. As you're aware, this year has been a struggle, a monumental undertaking. Educators across our country have been essential workers almost since the beginning of this pandemic, going into old buildings without any realistic social distancing measures until recently, not much of a mask policy, a direct contrast to the rules set out by the rest of society. My question to the panel is, once the most at-risk population is vaccinated, and with the chance that decision makers start to listen to the recommendations given by scientific and medical professionals, do you recommend that the provinces prioritize all our deserving education workers, daycare staff, primary, secondary teachers, who have been working on the front lines of childcare from the start of the pandemic at great emotional and medical risk to themselves, their loved ones? Thank you.
Okay, Dr. Kakar, that is a very passionate Stuart from Montreal. What would you say to him? Okay, so I think it's possible. In the world of COVID, we have temporarily lost Dr. Kakar while she gets her system sorted out. Dr. McGeer, what about you?
Yep. So certainly in Ontario, teachers are on the list of essential workers. I think we've had one of our challenges, of course, is there are a lot of essential workers, and all of us would like them vaccinated yesterday. And all of the education workers are clearly a priority, as are grocery store workers and TTC drivers and many other people who, carry the responsibility of seeing and being exposed to lots of different people every day. So yes, absolutely. Teachers are on the list of essential workers. People are working very hard to try to arrange to get essential workers and deliver it, fairly and equitably and yesterday, if we can, to all of those essential workers. So yeah, teachers are definitely on the list.
Very briefly, Dr. Kakar, now that we have you back, can you give us a sense of how teachers have fared during this pandemic in terms of their health?
Yeah, so in general, teachers have been isolated and getting sick occasionally from COVID, but the biggest issue is the constant on and off. So being in contact, being off school, and just the constant struggle that this year has been online versus in person. So it has been a real challenge for them. And I can tell you that as a pediatrician, we really appreciate the effort that all the teachers have made to keep kids in school, because it's been so essential to the mental health of children and their well-being. So as pediatricians, we're going to do everything possible to push that teachers get their vaccine, get on that essential priority list so that we can keep them healthy as well as the children.
Stuart, I see you nodding. Does that answer it for you?
Helps. It's been a huge undertaking at so many levels. But the smiles on our students' faces that we see every day, that's what is most important. We're the normal that exists in their life right now. And being in a room together, it just feels normal. Otherwise, we're all on our own. So let's hope that it will come about.
Thank you for all you do. Thank you.
You know, we've got lots of questions coming in live. Also questions sent in to us beforehand. Here's one of them from Elaine.
And I have a question about vaccination for immigrants. Everything on the news is about Canadians, but there's a lot of us here who are not Canadians or permanent residents. A lot of students, for instance. I'd like to know if we're in line to get vaccinated and when and where that will happen, or what we should do about vaccination.
Yeah, so that's a really important question. Dr. Sinha, do you want to take that one? What are the requirements? How does it work?
Yeah, so it's an excellent question because, of course, we have a lot of people here who are working and who are from other countries. We have people who are studying here. And so right now, we're making it very clear to folks that while we're saying Canadians, we're basically saying everybody who's here in Canada. So right now, for example, in Ontario, you don't even need proof of your Ontario health insurance plan because some people don't actually have their OHIP registration. We're just saying if you meet the criteria. So, for example, if right now, if you're above the age of 80, if you're in one of those phase 1 category groups, as long as you can book your appointment online, you can make your appointment, but it has nothing to do to link with your citizenship, and it doesn't have anything to do with your, for example, your health insurance status. Because frankly, it makes sense that we vaccinate everybody right now, because the sooner we get everybody around us vaccinated, the quicker we have herd immunity.
Yeah, the coronavirus certainly doesn't care whether you're a Canadian citizen or not. So that makes sense. We've got another question coming in from Samantha. Have a listen.
I'm in Yellowknife, Northwest Territories. I'm a third-year nursing student at Aurora College through the University of Victoria. I've been lucky enough to assist with some of our vaccination clinics and noticed that some individuals still remain reluctant to receive their vaccine. What is something you would recommend saying to these individuals to reassure them?
Dr. Jawanda, I suppose, I mean, the answer would change based on what the hesitancy is rooted in, but how do you tackle that sort of thing?
I have done a couple of vaccination clinics, and I get questions from my own patients almost every day about this. And you're absolutely right. There's not like a one fit answer. So you really do have to have a discussion as to what they're hesitant about. What are they worried about? Are they worried about the side effects? Are they worried about if they're trying to get pregnant or if they're of childbearing age? So you really just have to educate and address their individual concerns. I have found that in all of the patients that I have had the privilege to talk to and counsel, the hesitancy disappears once they know the facts and all the science-based evidence, and they feel good about it, and they all go on to get their vaccines.
Well, yeah,
so I think it's just about talking to people and helping them out.
And clearly, there's a lot we don't know, but a lot we do know, right, Adrienne?
Thankfully. All right, so lots more of your questions still ahead. We'll be right back. All right, welcome back to the National Studios, where we are taking your questions about your shot, if you've had it, what you're waiting for. And we're going to go live now to Stephanie, who joins us. Stephanie, I gather you're a mom to 11-month-old Isaiah. I'm presuming your little one is completely passed out right now.
He's sleeping, thankfully, so I'm going to leave him right where he is, yes.
Perfect. What is the question that you have for the doctors?
So yeah, he is only 11 months old, and we were wondering how are vaccines deemed safe enough to trial on babies?
Dr. Kakar, that seems tailor-made for you.
Yes, great question. So it's actually going to be quite a while before babies get a COVID vaccine, and it's really for two reasons. The first, and I think it's the best reason, is that babies really haven't been sick from COVID. So we've had hundreds of babies who've had COVID, but at most they get a fever. Some have had absolutely no symptoms at all, and it's really remarkable, but they don't have the same manifestations. They're not as sick as adults. So before we give them anything, we absolutely have to make sure it's safe. And the second reason is that the immune system of a baby is so different from an adult, because babies essentially get protective, what we call antibodies, from their moms when they're in utero. So for the first 3 months of life, babies are very much protected. So any vaccine we give, we really have to check.
Okay, so poor Dr. Kakar, we keep losing the essence of her signal, but I think you got the essence of her message there, Stephanie, which sounds like you don't need to worry too much. Have you been worried?
I have been. I mean, obviously I'm pro-vaccine, but you know, when there's a new vaccine that is just coming out and there's still so little known about it, you do worry for yourself and for, like she said, those with such fragile immune systems. So yeah, her answer helped, but definitely there's still some worry. Yeah.
Okay, Stephanie, thanks very much. And you know, these questions are all totally valid to ask, and until we get answers that you can understand, people being apprehensive.
Yeah, well, and valid even just from a population standpoint, right? Because when you think about not just babies, but children more broadly, so I'm a parent, I have 2 kids, but it also occurs to me that you don't really even get close to approaching herd immunity unless you start vaccinating children in this country. That's sort of an important piece of the puzzle. So I'm glad we're getting the questions that we're getting. These are all really smart. Let's go to another one. We've got Ahmed Hussein joining us right now. Hi, Ahmed.
Hi.
Hey, what's your question?
My question is, as the government looks to speed up vaccinations, to what extent can it prioritize for the residents in high-density neighborhoods that are disproportionately impacted by COVID-19, who are also mostly multi-generational families, and many of them are essential workers, to achieve more targeted immunization approach?
So that's a really smart question. Dr. McGeer, you're nodding your head on this one. What do you think?
Yeah. Well, yes, you know, I can't speak for cities across the country, but I can speak for what's happening in Toronto, which is that Toronto Public Health and the vaccination clinics are looking very carefully at how to deliver that. So one of the things that's happening is in large apartment buildings with a high proportion of older adults, the mobile vaccination clinics are actually going to go door to door through the apartment buildings so that people don't even have to leave home. Many of them obviously are older, may have difficulty with mobility, so we can deliver vaccine directly to them. And the placement of our vaccination clinics in the city is going to try to make it easier for people who live in those areas to be able to get to vaccination clinics and access them. And every day or two, somebody rolls out a new idea about how we can make this work better for our highest risk neighborhoods and for our essential workers. So I think you're going to see lots of creativity in the next few weeks about how we can really reduce the barriers to those people getting vaccinated.
And Dr. Jawando, what's your sense of that question from where you are in your part of the country? Because here in Ontario, I mean, there's a heavy regionalization of the rollout, right? 34 distinct public health units, all with their own plans. How do you see it?
I think Ahmed asked an excellent question. I think the goal of dispensing all this vaccine is to put the brakes on the virus. So when we have known hotspots, we have essential workers that are at higher risk. They're in jobs where they have to congregate. They cannot work from home. Those are definitely areas that do need to be looked at. They do need to be targeted. I know right now there is talk in BC that Dr. Bonnie Henry may earmark some vaccine for a breakout in Prince Rupert, and also to address areas of the workspace where adults do have to congregate and are essential workers and are at higher risk to get the COVID virus. So I think that's a very important question. And I think public health is doing its best to address this. And again, they're looking at the risk assessment of the populations and looking at vaccine supply. So I agree with Dr. McGeer that it's excellent, and we're all working day by day to make things happen.
Yeah, well, it's a global pandemic, but it amounts to many, many local problems. That's for sure. Dr. Jawanda, thanks for that answer. Ahmed, thanks for your question. That was an excellent one. All right, let's go to Lynn, who is also standing by. This is another live question that we have, or actually, it's a question that was sent in earlier from Newfoundland. Here you go.
Good evening, everyone. I'd like to know how we can be confident there will be no long-term side effects from these vaccines, considering it takes years of testing for other vaccines before they are approved. Thank you.
Fair point, fair question. Dr. Sinha?
Yeah, it's an excellent question, Lynn. And the first part is that, when it takes years of testing, before vaccines are approved, because it takes a long time to enroll enough people, have enough money, and it takes sometimes years before we can actually figure out, that a vaccine is safe and it's effective. The great thing is with a lot of collaboration, we're able to determine that within a 12-month period. What we do know about side effects with the vaccines is that most of the side effects that we'll ever see are really within 1 or 2 days. The sore arm, maybe a bit of fatigue, for example, a bit of a fever or a headache. We haven't really been seeing any major side effects or any major concerns from the vaccines. And the good news is we've had tens of millions of people who've now received it, and we're not seeing any reports of any major side effects that we think would become long-term side effects either. So right now we're seeing good things, but this is why it's really important that all of the vaccine trials and rollouts that are moving on, they have a requirement that we keep monitoring over the long terms just so that we can pick up anything of concern and we can make sure we address it. But nothing that I know of that has been coming up as of yet.
Yeah, the vigilance certainly continues. Thanks, Dr. Sinha.
All right, so we will be putting your questions to Health Canada's Chief Medical Advisor, the driving force behind the vaccination effort, Dr. Supriya Sharma. That's coming up in about an hour, but before then, let's go to our Zoom audience because I know James is standing by. Hi there, James. Is this helping you so far?
Yes, a lot of good information. My question has to do with mixing vaccines. If your first dose is Pfizer, does your second dose have to be Pfizer as well, or would Moderna do? Or alternatively, if your first dose was an RNA vaccine, would you get the same protection if your second dose was an adenovirus vaccine?
Okay, excellent question. Dr. McGeer, I'm also struck by the incredible medical education all Canadians have had over the course of the last year. These are striking questions.
Yeah, it's amazing how much more we all know about vaccines than we knew a year ago or even 3 months ago. And so the simple answer to that question is because we have clinical trial data, we try when we can to stick with those data, which means that we're not going to mix vaccines unless we have to, probably. But that you remember we said that we were also going to give 2 doses of vaccine, and now we're giving 1. So we'll have to see what happens. The way vaccines are rolling out now, it's not likely we're going to have to mix different manufacturers. And as long as we don't have to, it's a little easier not to do that. But the truth is, the way these vaccines look, it's probably just fine to mix them. You get a good immune response to each of them. You'll get a boost over what you have. You can clearly see the boost when people who have had COVID before get vaccinated. They get a better immune response than people who haven't had COVID. So mixing vaccines is probably going to be fine, but it's not something we're going to do unless we get into difficulty with vaccines. Or let's say we found out that some vaccine was better than another vaccine. By October and November, we're going to be swimming in vaccines. And then if we find out that one vaccine might be a little bit better, then we can give that vaccine to more people. So there's still a bunch of possibilities out there for what we might do.
All right, thank you. James, have you had a first shot of anything yet so far?
Nope, probably not till April.
Okay, you seem okay with that?
I don't like it. I'd rather be vaccinated than not, but I'll wait.
Okay, excellent Canadian answer. All right, thank you very much. So as we have been speaking with you, we've been getting questions online. I think we have one from Instagram, actually, from Colleen and Wayne, who say, my dad in long-term care received his second shot March 3rd. I get my first shot on March 11th. When is it safe to visit him? When can my grandkids have a sleepover, that amazing sleepover? Dr. Kakar.
So we're all working on trying to figure out those best guidelines right now. But the first thing to realize is that it takes at least 2 weeks, ideally 3 from your first shot before we can consider you protected. So it's going to be 3 weeks from the time that you get your shot. Now, your dad's had both his shots. So realistically, once you have your shot, it should be okay for you to be able to visit your dad. Sleepovers, on the other hand, now that's going to be a while because kids are not going to be getting their shots for a while, and they're still going to be in school and still in contact. So we still want to minimize contact between different families and different groups of kids. So the adults, as soon as you're vaccinated and you're both vaccinated, it should be okay. But unfortunately, kids, it'll still be a while until we have the vaccines enough so that we can be sure that a sleepover is safe.
I totally get it. I am waiting for the day when we start to get a flood of pictures of those hugs coming in, because you know it's coming. And it's going to be amazing.
My kids' ears perked up at the word sleepover. Just all of the alarm.
Right now.
It's going crazy now. Okay, I want to take a moment to give a big reminder to all of our viewers who are watching from British Columbia right now. Tomorrow, it's all about you with the special Our Shot Vaccinating BC Town Hall. Dr. Bonnie Henry and a team of experts will be digging deep into your situation. That's at 7 p.m. on most CBC platforms. We're going to be right back.
You should go. All right, welcome back to the National Studio. We want to, if we may, we want you to come on a trip with us because we're going to go to Whitehorse, because standing by for us, a very happy Jared and a very sleepy Ella outside the Yukon Convention Center. Jared, you're just about to head in to get your shot, I gather.
I am, yeah.
How are you feeling?
Pretty good, pretty lucky.
Why lucky? What does this moment mean to you?
Well, it's just a sign of getting back to normal, hopefully, or a hope that there's a new normal coming. So we're pretty excited about it.
How has this experience been for you? Like, what do you feel like you've had to go through?
Well, we've had to change our lifestyle a bit, but again, we feel really fortunate to be up in the Yukon where we were. Low numbers. I've been able to go to work. We've been able to send my daughter to school. So really fortunate, really. Love living in the Yukon.
I bet. And how is Ella enjoying school?
She's good. This is her first year, so she's pretty shy, but she's good. She's found that once she says the word sick, she's able to go home. So she used that today and got to come home right away and was completely fine.
Isn't that a miracle?
It's a loophole.
It's a miracle. Kids are smart. Listen, congratulations. Go get your shot, and we wish you all the best, okay?
Okay, thanks for the time.
Cheers.
I feel like just before Ella turned her head, I saw a little hint of a crack of a smile just coming out.
We'll have to rewind the tape and make sure.
Yeah, we'll zoom in on it. Hey, let's go to Susie right now, who's got a question. Hi, Susie.
Hi, I'm Susie Golding from Oakville, founder of the COVID Long Hauler Support Group Canada. I'm a long hauler myself, and I have a question regarding long haulers. If our body's initial immunological response to COVID put our immune systems into overdrive, how will it react to a protein that's supposed to mimic an immune response? And is it advisable for long haulers to have both doses of the vaccine?
Dr. McGeer, why don't you take that one? So long haulers, people who have already gotten sick.
Yeah, great question. And long COVID is both a mysterious disease and something that's really difficult for people who have it. Another good reason to get vaccinated, to protect yourself from it. The anecdotal evidence so far, and we don't have very much, is that if anything, long haulers feel a bit better, at least after a first dose of vaccine, but the difference does not appear to be huge. There are studies running now looking at vaccination of long haulers and what happens to them. One in Canada called Can COVID, organized by Dr. Chang out of the University Health Network. But we still don't have very much information. And so I think each individual long hauler needs to make that decision with their physician about whether it's best for them to get vaccinated or not. It is true that the vaccine stimulus you get is different than the infection. You actually get better stimulus of antibodies to spike. So on balance, it's probably a sensible thing for long haulers to get vaccinated, but it really needs some careful thought.
Okay, Susie, thanks for the question. And I mean, clearly a lot of these decisions that have to be made on an individual level are discretionary decisions that need to be made in conjunction with medical professionals.
For sure, but a lot of compassion for the long haulers because listening to Dr. McGeer, there's a lot of research to come and they are really suffering.
Don't go anywhere. We are about to start hour 2 of Our Shot, a national virtual town hall, and we'll start with a look at the day's biggest stories.
And we want to hear from you, so send us your questions to covid@cbc.ca. We'll put as many as we can to our doctors, including Health Canada's Chief Medical Advisor, the face of the federal vaccination effort, Dr. Supriya Sharma. Hour 2 of Our Shot starts right after this.
Good evening, I'm Andrew Chang.
And I'm Adrienne Arsenault. Tonight, we are putting Canada's COVID vaccines under the microscope.
You've got the questions, we've brought the experts. It's Our Shot, a special town hall.
Also tonight, the royal response to Meghan and Harry. It was terse. Did it make things worse?
Their traditional ways aren't cutting it.
A CBC News investigation uncovers more allegations against a hockey coach.
They need to be accountable for this.
And Canada's military leadership under scrutiny again. Could this help a big promotion for her? This is The National. This week, we all mark an important milestone, 1 full year since the official declaration of the coronavirus pandemic.
So tonight we're doing something a little different, a little special. We have convened a virtual town hall to talk about vaccines in Canada. And of course, you're all invited. And more than that, we're turning to viewers to ask the questions. You'll see their lovely faces here with us live. Give us a big wave. Hey guys, hello across Canada. Our doctors here as well, ready to explain where we all stand when it comes to getting vaccinated. We are going to get to that town hall in about 20 minutes time.
But let's start with the news, and that is dominated once again by a larger-than-life family now on the defensive. Today, Buckingham Palace gave its first official response to revelations and allegations unleashed by Harry and Meghan in a TV interview seen and discussed by millions. In London tonight, Renee Filipponi shows us how the royal response is being received.
How many grandchildren have you got?
At a vaccine clinic set up in a predominantly black church, Prince Charles ignored the media.
Sir, can I ask, what did you think of the interview?
It was his first official outing since damaging accusations of racism were leveled at his family from within it.
There's a conversation with you,
with Harry,
about how dark your baby is going to be?
Potentially, and what that would mean or look like.
The revelations from the interview have been reverberating for days now, pushing the firm into crisis mode, waiting to respond until the interview aired in the UK.
The statement from the palace today was short, reading that the royal family was saddened to learn the full extent of how challenging it's been for the couple, that the issues of race are concerning, and while some recollections may vary, they are taken seriously and will be addressed privately by the family.
It's not weighty enough to fully respond to what Harry and Meghan said.
This author says the statement doesn't go far enough.
The monarchy don't have the know-how of how to deal with such issues in today's society. It's a different world right now, and their traditional ways aren't cutting it.
The tabloid press, which has been a focal point of anger for the couple, issued its own statement in a stark denial.
The accusation that this was caused by sections of the British media who are racist, I'm afraid is just not true.
I'm sorry, I don't believe a word she says, Meghan Markle.
ITV host Piers Morgan, now disdainful of former friend Meghan, even questioned whether she really had suicidal thoughts.
Okay, I'm done with this.
Challenged by his colleagues, he walked off set today. This afternoon, it was announced he is leaving Good Morning Britain. Though causing chaos in the UK, the couple is at a distance from it all, living in the US with their growing family. Renee Filipponi, CBC News, London.
Okay, to the COVID situation now, and two stories that show how the immunization of Canadians is progressing. Now, in early February, supplies of the only 2 approved vaccines were limited, and boy, did it show. Across Canada, maybe 20,000 people a day were getting vaccinated. But we now have more approved vaccines, more doses, and over the past month, average daily vaccinations have nearly quadrupled. The majority of those doses have gone to seniors, particularly those in long-term care. In Ontario and BC, for example, more than 90% of long-term care residents have been immunized, yet outbreaks are still happening. Vicadopia explains why and what it means for all of us.
This long-term care home was the first in Kelowna to vaccinate its residents. The most recent shots went into arms last month, including into 8 of the 12 people who've now tested positive for the coronavirus. It's not clear if the latest variants of concern played a role.
And this serves to remind us that while we are very confident that vaccine is very effective and prevents particularly severe illness and death, it doesn't necessarily mean that all transmission will be stopped.
Of Canada's 2,000 long-term care homes, a few dozen continue to see new infections, if not outbreaks, even though most of their residents have been vaccinated, like this Quebec home outside Ottawa, where 23 seniors still tested positive last month, but most had mild to moderate symptoms.
What we do not know, and there's still limited evidence, but it is evolving, we'll get more, is how vaccines prevent transmission. Even the most effective vaccines are not 100%.
Even so, preliminary data show vaccines are already putting the brakes on infections and deaths among Canada's elderly. In Ontario, long-term care residents saw an 89% relative reduction in the incidence of COVID-19. And in British Columbia, vaccines prevented an estimated 80% of cases in long-term care homes just 2 to 3 weeks after the first dose.
If what comes out of this is that we reduce COVID-19 from being a severe disease that takes between 1 in 4 to 1 in 3 long-term care residents' lives to being an asymptomatic or mildly symptomatic illness, that's a huge home run.
And experts say that could be the reality for the general population as vaccinations start to roll out in communities across Canada. Milder symptoms, if any at all, but no guarantee of complete immunity. Vicadopia, CBC News, Toronto.
Now, to help us understand what this all means, we're joined now by geriatrician Dr. Samir Sinha. Dr. Sinha, what do we know about whether people can spread the virus even though they've been fully vaccinated?
Yeah, so what we're learning right now is that the vaccine, while it's very effective against preventing serious illness and potentially death, is that we don't know that it's 100% effective against transmission. And that's why we know that it's actually showing that it's reducing transmission or that ability to pass that virus from one person to another, but it doesn't completely eliminate it. And that's why we're still saying that even if people are fully immunized at the moment, we still want everyone adhering to public health precautions because we know that we can still transmit the virus while enough of it's circulating around.
Right, and then how do you continue to strike the right balance? Because I'm thinking once long-term care homes have completely completed their vaccinations, should they start allowing visits from loved ones who have also been vaccinated?
Yeah, and one thing that Dr. Henry said in BC today was that, despite that we're seeing some of these outbreaks occurring across Canada and around the world, what we're seeing is very mild outbreaks that are occurring, so not significantly leading to hospitalizations or death. And so what we're hoping is that as we get pretty much most of the residents and the staff and even family caregivers vaccinated, that by the end of the month, we should hopefully have some guidance out that can start telling us how we can start doing more congregate activities like dining or group activities, and also making sure that we can start resuming visits in more of a traditional way.
Looking forward to it. And hey, Dr. Sinha, we'll be back later in the program as we resume taking your questions around Canada's vaccine rollout.
So, okay, now to the vaccine rollout story elsewhere in British Columbia. And let's just say that it has been mixed. The government is being accused of mishandling bookings, especially in the health region that includes Vancouver. Greg Rasmussen looks at the frustration that is causing.
Let's give this a shot.
250 times and counting.
We are currently experiencing a high volume of calls and are unable to take your call at this time.
Adarita Guerrero is in her second day of nonstop dialing, trying to book a vaccine appointment for her 89-year-old father.
And I started calling 7 a.m. through to 7 p.m., close to 200 calls. Yeah.
After 50 more calls today, she has lots of questions.
After we've waited this long and brilliant minds are working on this, why is this such a bumbling effort?
It wasn't just technical problems. There was simply insufficient staff, particularly in Vancouver Coastal Health, to meet the demand.
The BC government is blaming TELUS, the company contracted to handle the calls. In a statement, it said the provincial government and health authorities asked us to support them, and we have let them down. Alberta had jammed phone lines and website crashes when its booking system opened 2 weeks ago, and Manitoba has also had problems. Despite the system working in some of the province's 5 health districts, BC's opposition wanted to know how the government could fail in Vancouver.
We saw the second largest health authority in our province, which serves a quarter of our population, manage to register only 369 people.
I mean, you can blame whoever you want to blame, quite frankly. We had a bad day yesterday.
Despite promises of a fix,
thank you for calling the Vancouver.
Problems remain.
Are you going to give up?
No, I'm not. I can't give up. No, I'll keep trying. Well, I'm thinking for my mom now.
Hoping to get through tomorrow. Greg Rasmussen, CBC News, Vancouver.
Well, the federal body that issues vaccine guidance in Canada currently doesn't recommend the AstraZeneca vaccine for seniors, but Quebec says it's giving it to them anyway. A report from the province's own experts says AstraZeneca is easier to store, easier to transport, and highly effective at preventing severe illness. However, it does still plan to prioritize the Moderna and Pfizer vaccines for seniors as long as there's supply.
More disturbing allegations have emerged about junior hockey coach Bernie Lynch, under investigation in Ontario for sending inappropriate messages to a player. As Jonathan Gatehouse tells us, parents of an Alberta team say they too asked for Lynch's behavior to be investigated.
I'm so angry.
For months, this billet mom raised red flags about a close, controlling relationship coach Bernie Lynch had with a junior A player who was boarding with her. We're not identifying her to protect the player, whom she says would spend 12 hours a day, 7 days a week, with his then 65-year-old coach, often alone at his apartment.
I felt as though my player was being groomed. I feel like he felt he had no other choice because his hockey career was in the hands of Bernie Lynch.
Lynch's behavior was a big concern in this small town. And in January 2020, parents and billet families wrote a letter to the Western States Hockey League outlining their fears about his relationship with the player. He cries a lot and has slipped into a depression. He refuses to wash his underwear at the billet family's house and takes them with him to Bernie's. These are serious accusations, and we encourage you to please investigate further. Please. The letter also said Lynch verbally abused and hit other players, and they felt their complaints to the team owner had led nowhere. In a statement to CBC News, team owner Axel Axman said he spoke to the player in question. who, according to Axman, insisted nothing inappropriate was happening with his coach. The owner also said he spoke to Lynch about his demeanor with players on multiple occasions. Lynch declined an interview but told CBC News the allegations against him come as a surprise and disappointment and called it a smear campaign. As for the WSHL, it sent the letter to Axman but didn't appear to take any additional action. In reference to the allegations, Commissioner Ron White told CBC News, should someone have credible facts backed up by proof, then someone has been sitting on that proof.
It shouldn't happen.
That response isn't good enough for the parents who came forward.
The WSHL needs to speak up. They need to be accountable for this, and so does the Edson Arrows. He's hurt a lot of people, and it's got to stop.
But Lynch didn't stop at Edson. When the season ended in March 2020, the coach left town, onto another team.
So, Jonathan, just listening to this, did anyone in Edson look into Bernie Lynch's background when they hired him as coach?
Well, Axel Axman, the team owner, says the Arrows did their due diligence when they were hiring Lynch. They had the RCMP run a background check and reached out to the most recent team he had worked for. And Axman told us that Lynch was forthcoming about a police investigation into his conduct in the late 1990s, which looked into allegations that he had had an inappropriate relationship with a young player in Saskatchewan, but didn't result in any charges. And they made the decision to go ahead and hire him.
All right, thank you, Jonathan. That's Jonathan Gatehouse from the CBC News Investigative Unit.
Well, for the first time in Canada's history, a woman will become second in command of the armed forces, part of a major shakeup in the top ranks of the military.
I am very pleased to see a strong woman in the vice chief position for the first time in Canada's history.
Lieutenant General Frances Allen is moving into the role of Vice Chief of the Defence Staff, overseeing day-to-day administration of the military. She's replacing Lieutenant General Mike Rouleau. It comes as the military faces a deepening crisis at the very top of its chain of command. Just weeks ago, Admiral Art MacDonald stepped aside as Chief of the Defence Staff, a job he had just gotten, facing an investigation into allegations of sexual misconduct. His predecessor, General Jonathan Vance, is also facing allegations of sexual misconduct. And tonight, more allegations of misconduct in the senior ranks of the military. CBC News has learned a senior officer in charge of human resources was himself investigated decades ago. Tonight, his case is being looked into. Ashley Burke brings us the exclusive details.
He's the commander in charge of all military HR.
This team, this military personnel command team, they care. I care.
Now coming to light, past allegations of his own inappropriate behavior, at the same time as the past two chiefs of defense staff are under investigation for misconduct claims too.
It's a crisis of leadership, it's a crisis of credibility in a high command, and a crisis of confidence in their senior leaders. I mean, it doesn't get any worse than that.
The allegations against Vice Admiral Hayden Edmondson dates back to the late 1990s, when he was a lieutenant commander overseeing naval training in Esquimalt, BC.
Your training to become a Mars officer involves some of the most varied, intense, and challenging courses you'll find in the Canadian Forces.
Sources say an investigation was launched into claims of inappropriate behavior with subordinates.
Aye, aye, sir.
4 sources with knowledge of the allegations describe suggestive, unwelcome comments, sexual advances, predatory behavior, and inappropriate relationships with female instructors and students under his chain of command. But sources called the investigation flawed and said not all witnesses and complainants were interviewed by military police. The Department of National Defense said Edmondson has never been charged or faced administrative measures and said allegations like this are thoroughly investigated and if founded, there are consequences.
I must say that I'm not surprised.
Krista Lee left the military in 2016 and is part of a class action lawsuit over sexual misconduct in the forces.
I think the military is a guys boys club, and I think that men are more apt to protect each other.
In a statement, the defense minister's office said that Harjit Sajjan learned about the allegations from the 90s yesterday and has since asked the acting chief of defense staff to look into the matter and report back as soon as possible. Ashley Burke, CBC News, Ottawa.
It is a controversial police tactic that's had violent, sometimes deadly outcomes. Some U.S. states are reconsidering so-called no-knock raids, but they happen hundreds of times a year in Canada, too. A new Fifth Estate investigation puts the practice under scrutiny. Here's Judy Trin.
Still see the marks on the door.
What could I have possibly done to have a SWAT team kick my door down?
A lot of cops pulled up.
Almost 5 years ago, Ottawa police bashed open Peter Schneider's door without knocking. They made him crawl to the curb. His son Ethan, just 13 then, saw it all.
They told me to go back inside and wake up my brothers and my friend. The guns were drawn to our head the whole entire time.
Police thought they would find guns and explosives, but the tip was bad. There was nothing. No-knocks are a tactic used to surprise suspects and catch them with the evidence, but they're only supposed to be used in exceptional circumstances. Last year, a judge found that Ottawa police were using the tactic too often and showing a casual disregard for charter rights. The Fifth Estate found several other cases across Canada of questionable no-knocks. In Calgary, police shoot a projectile to break the lock. In Kamloops, they ring the doorbell but don't wait for an answer. Then this raid last October. Anthony Oust was wearing a GPS tracker, waiting for trial on drug charges when police burst into his mother's home. Oust fell 12 floors out a window.
People should rethink this strategy. Do we want to live in a society where getting every speck of cocaine out of a drug dealer's place is more important than human life?
The rethink is happening in the U.S. Several states have already banned no-knocks. But in Canada, police still conduct hundreds of these so-called dynamic entries each year and believe they're necessary.
People are taken into custody without incident, evidence is preserved, and the cases are prosecuted.
Here to protect the community? Come on.
As for Schneider, he sued, and Ottawa police settled out of court, but never apologized. Judy Trin, CBC News, Ottawa.
You can watch the full investigation when police don't knock on the Fifth Estate. That's Thursday at 9 p.m. on CBC TV and CBC Gem. So vaccinations are underway, but anticipation is turning into confusion.
Was the vaccine testing done a little too quickly?
Where can I go in order to get vaccinated?
When can our children go back to the parks?
Coming up, Canadians have been inundated with a mountain of information. Our doctors are here to boil it all down and answer your most pressing questions.
Including Health Canada's Chief Medical Advisor, Dr. Supriya Sharma, joining us in just a few minutes as we return to our Town Hall special. Stay with us. Hey, welcome back to our special Town Hall edition of The National. Canadians are joining us from across the country as we focus exclusively on COVID-19 vaccines. Your questions have just been pouring in over the past week, so we're just going to get right onto another one from our virtual audience. We have Marguerite joining us. Hi, Marguerite. What's your question?
Hi, my question is there real scientific data on extending the time for the second dose of the vaccine?
Right, an extension to the interval to 4 months, as we've seen recommended by NACI. Dr. McGeer, can you take that one?
Yes, absolutely. Certainly for the first 3 months, there's very good evidence that one dose it's not quite as good as 2 doses, but it's better to give 2 people 1 dose each than 1 person 2 doses. Whether it goes out to 4 months, we're still waiting to see. We haven't had that long. So people are still reserving judgment about whether we're really going to stretch the interval to 4 months or make it a bit shorter. But yeah, there's good reason public health people are doing that.
Right, not settled science yet. Marguerite, thanks for the question. That's great.
All right, let's go now to Shantae, who is joining us from our virtual audience from Whitby, Ontario. What's your question, Shantae?
Hi, my question is, with what we know about antibodies, is it still recommended that people who've already contracted and recovered from COVID-19 still get the shot?
Okay, Dr. Sinha, really good question, especially as so many people have now had COVID.
Absolutely. The answer is absolutely. If you had COVID, we still recommend that you get the vaccine because everyone's immune response is a little bit different. And vaccination is the one way you're going to get the true best benefit that we know that the scientific data says you'll get. So if you had COVID, get the shot for sure.
All right, Shantae, thanks very much.
We have another question coming in. This is from James. We're going to throw it up on the big screen. My son is a special needs adult and has fear of needles. A lot of us do. Can he get the shot on his buttocks where he cannot see the needle, so somewhere other than the arm? Dr. Fatima Kakar, can you take that?
So in theory, yes, because it would be intramuscular, but we tend to try and avoid intramuscular injections in the buttocks in adults just because there's a risk of nerve damage. So it can be done, but it's a little bit more risky. We really prefer the arm. And we've had a lot of success using what we call these anesthetic patches, EMLA patches on little kids. So they really don't even feel the injection. So that's something I would try before the buttocks injections.
Okay, interesting. Yeah, once that age group is eligible for the vaccine, of course.
Okay, so now we have a question that came in on video from Aditya. Let's have a listen.
Good evening. My question for the panel tonight is, can fully vaccinated people gather again in a private setting? And if not, why?
Dr. Juanda, there's so many versions of that question we keep hearing, understandably. What would you say?
Well, I totally understand what he's saying. We'd all love to get together again. Once you have been fully vaccinated, I mean, theoretically, it's probably okay, but realistically, we do have to follow public health guidelines. And if we start bending the rules for a few people, it becomes very difficult to contain that for the whole community. So I still think we're still early in our vaccination program. I do anticipate that as more Canadians are vaccinated with their primer doses, the public health will start lifting guidelines, but we have to open the tap very slowly. We can't just, it's almost like what Dr. Bonnie Henry alluded to. It's a dimmer switch. We have to slowly turn it up. We can't just flick on the switch and have people meeting. So theoretically, yes, but practically, no. It's just not a great idea. I think it'll add to more transmission and more confusion. A lot of people are already confused with the rules and regulations, so we don't want to add to that.
Okay, the dimmer switch, good thing to keep in mind. Thank you, Dr. Juanda. Let's go quickly to Whitehorse. Again, this is an academic discussion on one level, unless you are in Whitehorse where the vaccinations are happening as we speak. I think, Lisa, you just had your shot, did you not?
I did.
So what does that mean to you? What was that like?
Just grateful. Grateful to live here and to be able to get our vaccinations to protect my friends and family. Yeah, I couldn't be happier to live in the north.
Lisa, what have you had to sacrifice during this time?
Well, just not being able to see your friends and family regularly. You know, wondering if everyone is okay. I think that's been hard. It's a year now, and so to be at this point, to be able to get our vaccination and hopefully get back to a point where I can visit with everyone, I can hug my family, that would make everything.
Is there something emotional in that moment when you get the shot?
I'm kind of feeling emotional now, but it's just, I think it's just this whole past year and now to be at this point. So I'm a little bit emotional now. I didn't expect to be, but I'm just really happy that I've been able to get my shot and that I live in such a great place that we have this opportunity to protect our family and friends.
Well, we're all very happy for you too. Thank you, Lisa. When we come back, Health Canada's Chief Medical Advisor and one of the faces of the federal vaccination drive, Dr. Supriya Sharma, takes your COVID vaccine questions. Welcome back to our special town hall edition of The National, all about your vaccine questions. So let's put some of those questions to Dr. Supriya Sharma, the Chief Medical Advisor for Health Canada. She is steeped in the data. Here is your chance to pick her brain. So let us begin with the question. Thank you for joining us, Dr. Sharma. Let us begin with the question that came to us on video from Jean Bocage.
Hi there, this is John Bocage calling from the Wasauksing First Nation near Parry Sound, Ontario. And I'm looking forward to getting the vaccine as soon as it's available. But I'm wondering, was the vaccine rollout, was the vaccine testing done a little too quickly? Is there a chance that there's going to be a problem with it in the future? Because most vaccines take years, and this one took less than a year to get developed and approved.
Dr. Sharma, that is a question that we get quite frequently. What would you say to John?
Well, I think it's a really good question because, as John said, we're accustomed to having vaccines developed over years and then having a Health Canada review process that in and of itself takes about a year. But here we are a year in from this pandemic starting, and we've got 4 vaccines, 5 if you count the Serum Institute of India one, already approved. So of course the question is, well, what corners were cut? And I really want to stress that we absolutely did not cut any corners when it comes to the development or the review. So, as soon as we knew that virus was out there and there's a potential for vaccines, all of the international organizations got together and we took what we knew about coronaviruses and this disease and we said, okay, so when we look at the development process, are there phases of this that can be skipped? And ultimately we decided no. There was enough unknowns that we wanted to make sure that all the companies went through all the steps that were needed to develop the vaccines. And then because of that, we do our review. So, the question is, then why is it shorter? Well, it's shorter because of the development time. So there's a lot of downtime in developing vaccines. So whether it's researchers waiting for grants, whether it's waiting for one study to finish before you start the other. But the biggest thing is that it often takes a long time to do the clinical trials because it takes a long time to recruit people in. All of that went incredibly quickly. And then even on the Health Canada side, we put dedicated teams together. We put, we've got teams that are only working on each vaccine. And so we actually did the same number of hours. We used the same standards that we would for any vaccine, and we just did it in a much shorter period of time. So what I would say is that we just basically crunched everything down to a really tight timeline because of how urgently we needed these vaccines.
Okay, that's important. We need people to digest that. We have a question from our virtual audience from Asana.
Hi, I'm Asana from Toronto. I'm currently 5 months pregnant. So I wanted to get your thoughts on COVID vaccine for pregnant women and if there's one that you recommend. Thanks.
Asana, thank you. I totally understand the urgency of a question like that and the anxiety behind it, Dr. Sharma.
Yeah, so what we know, we have to take what we know about COVID in women that are pregnant and the risks that are associated with that, and then balance about, what we know about the vaccine. So on the risk side, we know that women who are pregnant are at risk of having more severe illness with COVID-19. So that means more hospitalizations, more severe disease. And that's because, already their lungs are working overtime, there's less space for it, their immune system is sort of down regulated a little bit to protect the baby. So we already know that that's a group that could potentially have more severe disease. But what we also know about the vaccines is that the clinical trials did not have people in them that were pregnant. So it was one of the exclusions. So then we have to take a look at the information that we have. So what we know so far about the vaccines is that from the early tests, there weren't any signals for problems in pregnant women. We also know from real world experience, for example, just in the United States, as of February, there were probably about 20,000 women that were vaccinated who were pregnant, and we haven't seen any signals there. So on balance, what the recommendation is that for pregnant women, especially if they're at risk for other reasons, if they have other illnesses, or if they have other risks of transmission, that we do recommend they get vaccinated. The vaccines that we have the most information on, because they were approved first, are really the Pfizer and Moderna vaccines. So in general, I think we would say, have a discussion with your physician for sure. Take a look at the risks and benefits. But most doctors would say, yes, we would recommend vaccination for women that are pregnant a little bit later on in the pregnancy. So maybe after 24 weeks. And that we are continuing to do clinical trials in women who are pregnant. So we'll have more information coming. So I think the bottom line is that there's no wrong answer. You really have to take all the information that's out there and look at the benefits and risks and decide what you feel most comfortable doing.
Dr. Sharma, if I may, the advice has been a bit contradictory in the past, you know, and I'm wondering, is the science settled in the sense that you feel comfortable that this conversation we're having now is not going to change in 3 weeks and you're going to say to women, don't do it?
Right. Well, I mean, I think we're learning as we go with COVID, right? So whether it's on the disease side or whether it's on the vaccine side. So, you know, it's only the responsible thing to do is as we get more information, we make changes in the requirements and the recommendations. But what we're seeing with you know, specifically for pregnant women, is that all the data that we've seen so far seems to be moving in the direction that it would, you know, become recommended. But you know, until we have the clinical trials, it's really difficult to say 100%. So what I would say is that we have more information about the vaccines than we did when we first authorized them. It's all moving in the right direction. It's all looking positive. But, you know, it really depends on what we see. And if we have new information that comes forward, you know, we will make other recommendations. But I would be very, very surprised if we would have information to say absolutely don't get vaccinated.
Hey, Dr. Sharma, speaking of uncertain situations, this is Andrew, by the way. Hey, nice to chat with you again. I got to ask you while I have you here about the AstraZeneca vaccine. And I know you know this, but just to take viewers back to recap how that played out here in Canada. So it was back in February 26th that Health Canada issued its authorization for the AstraZeneca vaccine for all ages, so including seniors. As you know, a couple days later, NACI, National Advisory Committee on Immunization, issues its recommendations that it should not be used in seniors, so people over 65. And now we have most provinces in this country going with the NACI guidelines, not giving it to seniors, despite the success of this vaccine that we've seen overseas and in Europe. Is that a mistake?
So, you know, it's the same sort of thing. We go with the data that we have. So when Health Canada authorized AstraZeneca, you're right, we did authorize it for people 18 years of age and older. There is a notation in that product monograph, in that summary of information, that says that data from clinical trials is limited. So we also acknowledged that we didn't have as many people in clinical trials, 65 years of age and older, that we would have wanted. But as you said, we've had a lot of experience in different countries using the vaccines in those older groups, and that real world evidence shows that it is likely safe and very ineffective in those groups.
Right.
NACI looks at it a little bit differently. What they look at, so when Health Canada looks at it, it's like if you get vaccinated versus if there's no vaccine. NACI is looking at it, and I think maybe it's the wording that's a bit unfortunate. So instead of saying, you know, you shouldn't use this vaccine in people that are 65 years of age and older, it really is saying, hey, we've got these other vaccines, these 2 other vaccines that have been authorized, and there's way more information from those clinical trials in this older age group. So there's a recommendation that if you have a choice, use those other ones.
So Dr. Sharp, well, I have 10 more seconds. Would you expect NACI to change its mind in the near future on this?
So NACI is actually even meeting tomorrow to discuss this, right? So they're going to continue discussing it. There's more information coming in practically every day. So they will take a look at those recommendations and they will update them as you know, as needed. We're seeing that in other countries as well.
Of course.
So, you know, other countries as well initially said, you know, we'll maybe limit it to age 18 to 64, and then they've expanded it as well.
Dr. Sharma, excellent to speak with you as always. Thank you so much for taking the time to clear a lot of this up for us.
Well, thanks for having me.
Oh, actually, wait. We actually have one more question. Siddhant is standing. Oh, my gosh. How could I have missed? Siddhant, you've been waiting so patiently. You have a question for Dr. Sharma.
Yes, I do. How long will it take for all the Canadians to get vaccinated?
Well, there you go, Dr. Sharma.
Oh, so Siddhant, that's a great question. You know, we're in a situation where the supply is really increasing of the vaccine. So just this week. Oh.
Yeah, sorry, Dr. Sharma. We only have about 15 seconds left. I just got to get right to the answer there.
Okay, so we've got a lot of vaccines coming in. We should have enough coming in to vaccinate everyone by, at least with their first dose, by June. But there's a lot of ifs there. A lot of things have to happen to make sure that all of those vaccines come in and we can get them into arms.
Oh, my gosh. We'll try to block out more time with you at a future date. Dr. Sharma, thank you so much for taking the time. Appreciate it.
Thank you very much.
And we've got lots more coming up on the program.
You bet.
Hey, welcome back to our National Town Hall, where we are taking your questions and putting them to the experts. Questions about the vaccines in this country. This one's coming in from Levi here. I'm going to read it on the big board. Can you please tell me, Dr. Kakar, this will be for you. Can you please tell me what summer this year will look like? Hopefully hot. What do you think?
Oh, I wish I had the magic answer. I think it's going to look a lot like last summer. So the good news is that we're going to be outdoors. Things are going to be opening, restaurants, terraces. We're going to be able to gather, but we're still going to be maintaining some element of distancing. So I don't think we're going to have big crowded festivals and music festivals. And I think international travel is still going to be very limited, but it's going to be like last summer. And the more we're outdoors, the less virus is going to spread. So I think we're going to have actually a very good summer. And we're going to cross our fingers that we have enough people vaccinated over the course of the summer so that everything's okay by fall.
Yeah, of course. That's the big point there.
That would be fantastic. Let's go now to our Zoom audience. Emily, I think you're standing by. I know Emily. Emily is just coming back into the Zoom room, as it were. But you know what? I'm going to ask Emily's question for her. I hope you don't mind, Emily, which is, how will we know when we have reached herd immunity? Dr. Sinha.
Yeah, that's there's not going to be a magic day where all of a sudden, Theresa Tam is going to say to us, okay, we can mask off, hug each other, do everything we want. Generally, we like to say that we want to reach a level of community protection where about at least 80 to 90% of our adult population is vaccinated, so that at least 80% of our overall population. So just like we don't know when we're going to have this vaccine approved for children, we want to make sure as many of us are vaccinated so we reduce the risk of transmitting this and reducing the risk of us getting potentially sick and harmed by this. So it's not going to be one day, but we're going to gradually reach that stage where we feel that we've reached enough of that level where we can then start relaxing restrictions and going back to what we thought was normal before.
Okay, Dr. Sinha, thank you. And there she is. There's Emily. I hope you heard Dr. Sinha's question. Answered it basically for you? Yeah. Okay, thank you, Emily.
Okay, we'll be right back with more of your questions. Stay with us.
Welcome back to our National Town Hall, where we are taking your excellent questions and putting them to the doctors to try to help us through this. And we have a question to go to now on video. It was sent to us from Kevin Loring.
Hi, my name is Kevin Loring. I live in Metcalfe, Ontario. And my question is, when will all of the pandemic restrictions be lifted? When can our children go back to the parks and play with other children without wearing masks? And when can we gather again in theaters to see live events or to watch a movie without having to social distance or wear a mask?
Okay, thank you, Kevin. So that is probably the most important question of this whole thing, which is, when is this pandemic over? Dr. McGeer, your smile is the broadest here, so let's go to you.
Well, yeah, and the answer is really frustrating, which is the only answer I have is not soon enough. As we just heard Dr. Sinha say, this is going to be a slow progression where as we get more people vaccinated, we're going to be able to back off gradually. And it's going to be one of those things where one day we'll kind of wake up and say, well, look at that. Okay, I can hug people. My kids can play in the park. But it's going to be a slow process. It's going to be a gradual process. It depends on vaccine supply. It depends on how many people get vaccinated. Depends on what we decide to do about travel. So still too many unknowns to be sure. I'm hoping for the end of this year, but you know, that's just a guess.
Okay, Dr. Kakar, about 15 seconds to you. Quick thought.
I'm optimistic because outdoors in the summer is such a low risk for transmission. So really, I expect children will actually be able to play in parks and be outdoors without masks. It's just we don't want them still to be hugging each other and too close to each other and giving each other high fives. So not normal play, but regular play very soon, I hope.
Listen, I'll take any play I can get. Thank you very much. We will be right back.
Hey, welcome back, and that's it. Thank you so much for joining us tonight. My gosh, big thank you to our doctors, Dr. Jawanda, Dr. Sinha, Dr. McGeer, Dr. Kakar, of course to Dr. Sharma for joining us earlier, and to our lovely virtual audience. There they are, waving today. Thank you for all of your brilliant questions. It's been incredible.
Send us pictures when you get vaccinated, okay? Do you promise? We want to see them. Before we go, though, we wanted to ask, what will your moment be once you get the shot? A few Canadians have some ideas on what they want to do once they're fully vaccinated. So tonight, we're bringing it back to you. What some of you hope your moment after the shot will be is our moment tonight.
I'm looking forward to hugging my son and my friends and doing the things I love to do, like going to plays and museums and just having a meal in my favorite restaurant.
After vaccination, my sister and I hope to move to New Brunswick, where we're building a home.
I will be able to take my son to his soccer and swimming programs.
I know it's pretty cliche to say that we're all in this together, but we really are. And I want to do my part to help protect my community.
I'm really looking forward to going to a ball game with 20,000 of my closest friends.
The thing that I am looking most forward to when all of this COVID is finished is being able to hug my family, my friends. I guess you didn't realize just how much you miss that contact with people. Once this is over, this is going to be the best.